Hey everybody, today we want to talk about side sleeping being the best sleep position that you must do for sleep apnea is a big fat lie. There are some truths, but half truths kind of leave you wholly frustrated when you miss out on important nuance and detail. So we've been lied to, and these t-shirts are not available anywhere, but if you do want one, maybe if I get enough comments, maybe I'll make that. But the whole idea behind side sleeping, and I'll show you a lot of the data, but a lot of the facts that say side sleeping, side sleeping, side sleeping, I'm just gonna read in between the lines here, have to do with the fact that side sleeping is really the only one compatible with a CPAP. Now, correct me if I'm wrong, there might be some sort of way to sleep face down and use a mask here, but probably not. That's why big old CPAP has been just suppressing the research. It hasn't. I just was making graphics and getting a little bit carried away. But what we will not get carried away in is getting a lot into this like mysticism around the different sleeping positions because you'll hear from different influencers like, oh, if you sleep like this, then it means that, and you have like suppressed childhood trauma that you need to release every Thursday. Um, but the thing is, when looking at the actual research, it becomes very clear in terms of what is truth versus a sort of myth. That's why I want to go over what the research has shown about sleep positions for sleep apnea, and then also those little micro nuances, right? If you sleep curled up versus extended, what does that mean for you? What can be done there? And of course, this is for educational purposes only. All right. Don't do anything based off what I'm saying. Always talk to your doctor before doing anything at all. And we're going to cover the truth about positional sleeping, which is what that is, what other sleep positions, what they say about you, and how to pick your best. So stick with me here and make sure you subscribe. So, first section, I want to talk about going beyond side sleeping, if you will. Now, side sleeping, it does make sense. I'm not saying it's useless. I'm not saying it's absolutely the worst thing ever and just doesn't work at all. But first, real quick basics. So the idea is you lay on your back, your tongue goes to the back of your throat, which is what we don't want, blocks off your airway. That's true. We don't want that, which is why a lot of the thinking is, well, if we can get our tongue out to the side like this, like good old Mr. Doggo here, by sleeping on our side, that'll be way better. Now, like I said, that is partially true, and there is a better way to do it. I'll talk about soon here. But just overall to give you a picture here, when we're trying different positions, whether that's side or front, I mean, there's only so many, right? Positional therapy is really overlooked and very, very powerful. So just to go over the history of people monitoring people sleeping in different positions here, it can really have a big impact on your AHI, your sleep apnea severity score, right? It can take you from 55 to 21, 9 to 4, 40 to 3. It has very profound effects with before and afters here. Now, these are all different types, right? Using a foam wedge or using a tennis ball. We'll talk about that in a moment. But it's very, very powerful. And in fact, if you look at some research that compares CPAP versus positional therapy, it's actually pretty effective still. When looking at this, and this is looking at AHI reduction. So it's a little bit weird of a graph, but let's say if you use a CPAP in this study, a big meta-analysis where they took a bunch of studies and mush them together to have a study salad. Nobody likes salads. What would be a casserole? Some mush of tastiness. But what they found here was that CPAPs on average typically will reduce AHI by about 10 points. Okay, that's pretty good. Positional therapy will bring it down on average by 6. Now, one of these is a little bit bigger of a hassle than the other. I'll let you guess and decide which one. It's the CPAP. And by the way, I'm not saying anyone should stop their CPAP or anything like that. So, like, don't whoever was going to write the big paragraph in the comments. Actually, if you were going to write a big angry paragraph in the comments, please still do so. It's great for engagement. Nonetheless, you probably don't even watch the video anyway. You probably just look at the title and decide everybody wants your opinion. Now, my asides aside, it's very, very clear that sleeping on your back is really bad. We'll just kind of go about that here. But the big question needs to be is about tummy time, because this is a question you should ask yourself every day. What about tummy time, right? I mean, maybe we thought that when we were 3 months old or whenever you're supposed to do tummy time. But it's a question that should linger well into adulthood because the answers are, let's say, if we do this pure prone positioning, also known as PPP, three Ps, I think people, scientists, just like to make acronyms like you sound cool. I mean, I do it. I literally do that all the time. But what they found is that AHI reduction, and this is like just one night, okay? And positional therapy does become a little bit more effective as the nights go on. But what they found was this was able to take AHI from, geez, around like 18 here to about 12, which reflects what we saw earlier, right? A reduction around 6. Cool. And then for sleep efficiency, we also saw a pretty good improvement of about 80 to about 86%. So that's nothing to laugh at here. And another study found something very similar of where perhaps a bigger change, as you can see here, or AHI without it with the PPP, pure prone positioning. What makes it pure? I don't remember that. Maybe they had holy water or something. I don't know. But it took us from like 24-ish to like 7.2 there. I don't know. But a pretty big reduction here. Now you may be wondering, like, why not just sleep on my side? Okay, well, likely someone looked at that. So they did a study here where they looked at different mattresses and pillows that actually augment prone positioning. And on the left here is without MPP. That's so funny. It's mattress prone positioning or pillow. No, that would have to be mattress here. Yeah, mattress and pillow for prone positioning, MPP. I tell you, you got a research paper, and the next thing you know, you're making acronyms out the wazoo. And big reductions here. All right, let's say is that a median? Yeah, median of around 26 all the way down here. So big, huge results here. And what they found is that lateral, sleeping on your side, and prone are somewhat similar, meaning that really it's about what's finding best for you. Because we're told prone bad, lateral the best. Everybody has different bodies, everybody has different mattresses. It's all about finding what works best for you. And there's many studies. I was going to insert more, but I was like, geez, I feel I'm just like a little too over the top today with just references. But a lot of studies suggest that prone positioning is actually superior to lateral in some individuals, which may be you. So that's what we want to figure out. How can you do that to test that for yourself? And then, of course, we'll get into what should just be a Cosmo article about what your sleep position says about you. So let's dive into that next. Did I lose everything? Probably not. All right. Now, how you can test this out. So you always want to have some sort of like metric, right? Now, you may be using a CPAP and you may be able to measure your AHI on that. You may be something to detect your snoring, like Snore Labs or Shut Eye. You could use that. You could have an Aura Ring. You could have an overnight pulse ox. You could hire someone to stare at you and sleep at night. You could totally do that. Would you want to? Probably not, but it's an option. And when you're considering which one to test out, because maybe you don't really pay any mind to what position you're in, you want to consider the following here, okay? And theoretical in general. I'm not telling you what to do, I'm just telling you what to consider. So when considering these, really the biggest thing is comfort, all right? So I know a lot of people will say, oh, sleeping on your back's best for your back, or so on and so forth. I spent like 3 hours researching, and like there's actually very few studies that demonstrate like, oh, sleeping on your side will allow your spine to do this or that. It's a lot of people just sharing their experience, which is fine. It can be valid, but again, everybody's going to have their own individual flavor. The only study I found is that sleeping on your back can increase lumbar pain in certain populations. So again, this whole thing about like prone sleeping is going to destroy your neck. I haven't found anything that suggests that. Maybe Big Pillow wants you to believe that. But again, just your consideration of what's more comfortable for you, because really you want to find a comfortable sleep position. And then the other thing is that with prone, you do have to do a little bit more fidgeting to stay there. Whereas lateral, you can use things like a pillow behind you, a tennis ball on your back, a fanny pack, an anvil behind you, all things that can be utilized there. I was just joking. You don't need to use a tennis ball. You thought I was going to say about the anvil, right? But use a tennis ball over an anvil. Anvil's probably not good. And of course, if you're using a CPAP, prone sleep is going to be pretty hard unless you like sleep on a massage table. That's one of those like base things. All right. But for prone sleeping, which is what this is kind of about this episode here, is you can get one of these things here. I'm not talking about this plant, which is Who has a plant that close to your bed? Like, that's kind of suspicious. But this pillow here, which if you want to search it on Amazon, a body pillow, and I put the word prone in there to help out. So you can get something like this to add onto your bed. You could find this full pillow thing. I couldn't find it when I was searching for it. Maybe you have better skills than I do. And you can also have this as well. Okay, you do not need to be pregnant to use this. I did check the manual for this. It's just a suggestion that you're pregnant to use it, but non-pregnant people can also use it there. Now, other ways, if you don't want to get a bunch of crazy pillows, you can just use a thin pillow for your head. So then you're not, because some people don't find it comfortable with that amount of extension. You can also put a pillow underneath your hips. That will help as well. Using a firm mattress will also help. And then having your arms like underneath the pillow, if you will, like this. I'm not really being helpful in demonstrating right now. But if you do that, it'll allow for better angles there. Now, what also helps with sleeping prone is subscribing. Most people don't know that. It's not clinically tested yet, but research is indicating that subscribing to the channel also helps with your sleep. So with prone sleeping, how you want to test that? I mean, just honestly, before you even get all these pillows and stuff, I would just try the simple stuff, measure things, and then if you're seeing signs of improvements, you could consider investing in one of these spaceship looking. I mean, it looks like these things should be floating in a pool, right? Anyone else see that? Is that just me? Anyway, and just measure your before after and just follow the veins of improvement here. Now, for the Cosmo edition of sleep, of where sleeping slightly to your left means you're outspoken, and sleeping to in this position means you're worried. Let's demystify things. That looks like Andrew Huberman, doesn't it? That's kind of funny. Like I made it on a what's it called Grok. Made an image. I said have a health influencer look like a mystic. Anyway, this is the only study I could find about sleep positions and personality. And the one thing that I want a lot of people to understand is a lot of these psychology studies, it's they really should be retitled. We research things in people who were 18 to 22 years old in college, and here's what we found. Because a lot of times it is psychology students who want like 10, 15 bucks. I mean, I was one of them. I mean, it's like easiest money you'll ever get as a college kid. Um, but what they found here, I'll kind of skip to the main findings here, is that, and this is just like a snapshot. This is not correlation, causation, none of this. They just rounded up a bunch of college students, asked them what position do they sleep in or wake up and find themselves in, and some personality questions here. So what they found, these were somewhat weak associations, but let's just go with it anyway, is that if you sleep in this semi-fetal position where you're kind of like bent up, then, you're more sociable or high activity. So things that could sort of, with the high activity, because you don't want to be going like this with your mind before you sleep, relaxation techniques, super duper helpful for you. If you're even more curled up, you go full fetal, as they say, then it just is an extension of that, of using even more stress reduction things, journaling, mindfulness, etc. Now, if you sleep face down, then you tend to be more impulsive and perfectionist. And it just comes back to just mindfulness, right? Or even like doing things and being fine with imperfections and things of that nature. Like when I just completely go out of the camera shot, I don't really care. And then lastly is sleeping on your back, which was associated with being slightly more confident. Okay. I don't think anyone with sleep apnea should be sleeping on their back anyway, nor do I think sleeping on your back is this like big achievement in your sleep. So there we go. For those who want the free guide on sleep positioning, get some tips and stuff in there, and literally what I just said, you get that. If you want the sleep apnea reset protocol, which shows you different breathing exercises and all that stuff, you can find that there. For both of them, just go to the link in the description. You can find the description. If you're on mobile, just gotta click that. Boom, opens up. There it is. Awesome. It should also be on screen just about now. The sleep apnea reset protocol. You can click that there. And of course, if you want to go to directly to a website, the reset protocol is ochnow.com/reset, and the free guide is ochnow.com/side lies. Okay. I was feeling kind of crafty there. Positional therapy was too long, so side lies for that. And then the reset protocol is just ochnow.com/reset. Got some QR codes for you there. And of course, if you subscribe, then I mean, you really don't get anything besides subscribing. Satisfaction is what you get, and you are awarded 10 brownie points from me. Those are non redeemable in most countries, but you will have those nonetheless. So there's everything there for you. Thank you for watching, and have a good one.